As always, a comprehensive physical exam is necessary, and this should include assessment of body condition and muscle condition scores, in addition to the trends in these parameters over time, if the medical record permits this. One should also gather a detailed diet history, and of course, if you can, collect a minimum database whenever possible to identify underlying conditions that might be nutritionally responsive. In chronic kidney disease, renal function generally declines over a period of months to years. In the first stages, compensatory changes allow maintenance of homeostasis despite the progressive loss of functional nephrons. Symptoms or clinical signs of CKD generally occur later in the course of disease when the functional renal mass is less than about 25% of normal. And in terms of iris staging, clinical signs of CKD are usually mild or even absent at stage 2 and may progress when you're in stages 3 and above. But often nowadays, chronic kidney disease is diagnosed before clinical signs appear. SDMA is eliminated primarily by glomerular filtration, and it can be used as a surrogate marker of GFR for diagnosis and staging of CKD. Serum SDMA may be a more sensitive biomarker for detection of early CKD when compared with serum creatinine. This is especially true in dogs with low muscle mass and a low baseline creatinine. The current recommendation is to use SDMA in conjunction with creatinine, and for both parameters to interpret them in the context of repeated measures over time versus a one-time value. Renal Detect is positioned as a tool to predict cats at risk of developing CKD within the next 12 months. This uses one set of results of 3 parameters, so plasma creatinine, BUN, and urine-specific gravity. Cats at risk can then be recommended for either further investigation or monitoring more frequently than annually. Renal Detect's algorithm actually takes into account the patterns that have been observed for these 3 parameters in a large population of cats. The model has a sensitivity and specificity of 87% and 70% respectively. In my ideal world, we would perform a minimum database at least annually in all pets to help identify trends in the clinical pathologic data and make our diagnoses as early as possible. But we do know that the prevalence of CKD dramatically increases with age, especially in cats. It's been estimated that roughly 10% of cats over 10 years old and 30% of cats over 12 to 15 years old may have CKD. So for this reason, especially in cats, it may be prudent to begin regularly monitoring their renal function as they approach their mature and senior years, which we can roughly define as above 7 years old. For senior cats identified as at risk of CKD in 1 year with Renal Detect, or those with early stage CKD, it's reasonable to reevaluate those cats in 4 to 6 months. For cats identified as not at risk of CKD in 1 year with Renal Detect, I think that a follow-up evaluation 6 to 12 months later is reasonable, depending on the cat's overall health condition. So we recommend to feed an early renal diet for cats in CKD stage 1 and in cats predicted at risk of CKD within 1 year by Renal Detect. These cats may already be in CKD stage 1 or develop stage 1 within months. Our early renal diet is moderately restricted in phosphorus and protein and also features antioxidants and EPA and DHA. The milder phosphorus restriction and lower calcium to phosphorus ratio may be beneficial for cats at this stage when you compare to a classical renal diet for azotemic CKD. And this strategy is consistent with the current IRIS treatment guidelines.